Heart arrhythmia. Heart arrhythmias affect more than 4 million Americans, most of whom are over the age of 60. You might be asking yourself what a heart arrhythmia is. Most people have experienced some form of an arrhythmia in their lifetime. Most are brief and generally harmless, but sometimes they can have dangerous side effects or symptoms. A heart arrhythmia is a condition where the heart beats too quickly, slowly, or irregularly. This irregularity caused when the electrical impulses that control your heartbeat aren't working properly. This condition is a malfunction in the heart itself, when the heart loses control for a little bit. These can feel scary since your heart is literally skipping a beat, or beating too quickly or slowly. The arrhythmia comes with its own set of symptoms, which include a flutter in the chest, a racing heartbeat known as tachycardia, a slow heartbeat or bradycardia, chest pain, shortness of breath, lightheadedness or dizziness, sweating, or even fainting. Medical attention should be sought out if you experience an onset of these symptoms, or if you experience multiple symptoms at a time. The sinus node is located in the right atrium in the upper right chamber of the heart, but if you look at the picture, it will be located in the upper left-hand corner of the heart and controls the natural pace of the heart. This is where the electrical impulses that control your heartbeat originate. These impulses will travel through the atrium, causing the muscles to contract, in turn pumping your blood through your body. In a healthy heart, this will cause a heart rate of about 60 to 100 beats per minute. People with an arrhythmia have an irregularity in this part of the heart that can be caused by many factors such as high blood pressure, which could change the electrical pathways in the heart, blocked arteries known as coronary heart disease, which is damage to the heart based on a previous attack, obesity, smoking, drinking excessively, drug abuse, diabetes, since blood sugar levels also influence heart rates, sleep apnea, stress, or even genetics. Some people can have a heart abnormality since birth. There are 4 types of heart arrhythmias, which includes premature beats, supraventricular arrhythmias, ventricular arrhythmias, and bradyarrhythmias. Premature beats are usually harmless, but don't often produce symptoms. If there are symptoms, it was a flutter in the chest, or some patients referred to it as a skipped heartbeat. These types of arrhythmias occur naturally, but can also be caused by stress, overexercise, too much caffeine, or nicotine. Supraventricular arrhythmias start in the atrioventricular node, a group of cells located between the atrium and ventricle. This type of arrhythmia is tachycardic. Ventricular arrhythmia is an arrhythmia that starts in the heart's ventricles, in the lower half of the heart. This can be very serious and usually requires immediate medical attention. The final type of arrhythmia is bradyarrhythmia, and this occurs when the heart beats slower than normal. When this gets too slow, not enough blood will reach the brain, and this can cause the sufferer to pass out. A previous heart attack, aging, underactive thyroid glands, imbalance in chemicals, or other substances or medicines can cause bradyarrhythmia. There are many treatments for heart arrhythmias, such as pacemakers, medication, surgery, or even some alternative treatments. The pacemaker sends out electrical impulses that would stimulate the heart in order to create a steady heart rate. Pacemakers are usually implanted in patients that have a slower heart rate or a condition known as bradycardia. For a condition known as tachycardia, or an abnormally fast heart rate, a medication is generally the preferred course of action. An antiarrhythmic medication is usually prescribed in order to slow the heartbeat down to a normal pace. In a few cases, surgery is the only option, but it is only used when the other courses of action aren't working. There are 2 types of surgery that can be performed, a MACE procedure or a coronary bypass procedure. The MACE procedure is when the surgeon makes an incision in order to create scar tissue since it won't conduct electricity. Coronary bypass surgery is a procedure that diverts blood flow by creating a new pathway to the heart and improves the blood flow. There are also alternative treatments since arrhythmias are sometimes caused by stress. Studies show that yoga, meditation, and relaxation can all improve this condition, but it is still being researched. Following a few steps can prevent all of this. 1. Stop smoking, and try to avoid secondhand smoke since tobacco is linked to 1/3 of all cases of heart disease. 2. Limit your current intake of caffeine, alcohol, and other substances that may either raise or lower your heart rate. 3. Try to avoid unnecessary stress, anxiety, anger, or even fear since they all affect your heart rate in one way or another. If a situation is unavoidable, limit the amount of stress if possible and plan ahead for ways to deal with the stress. 4. Choose to live a heart-healthy life. This is the best way to prevent getting an arrhythmia. This includes exercising, eating well-rounded meals, and maintaining a healthy weight. Along with these steps, make sure to get a physical exam from your doctor and talk about it if you have any of these symptoms. The best way to keep your heart healthy is to keep your whole body healthy. Make sure to exercise and eat properly, and your heart will thank you.